What is the process of cell division during human reproduction?
So, I'm a nurse practitioner I work at Ascension Medical Group. So, I was looking at some of these questions before we got going here today, and I was like, you know what, I better refresh some of this stuff. So, when you go through biology and you do those things, you learn all of that. And it's so important for to build on building blocks for your education and your profession. But mitosis, the whole thing with mitosis, you got to remember that these are non-reproductive cells. So they're cells, somatic cells, like in the lungs, the gut, the hair, the skin, the muscles, and it's the same chromosome. So the same chromosome and the same DNA you have in every single cell. So that's what mitosis is. But then when you look at meiosis, that's a totally different thing. That's more the reproductive cells. It's a type of division that creates basically the egg and the sperm, the sex cells. So, what is important to remember about meiosis is that, none of the cells are the same. So, you start with the main cell, if you want to call it that. And then as it actually divides, it's called crossing over, genetic recombination, where pieces of actually the DNA will break off and attach to another section as well. So you never have the exact same cell. And that's honestly what makes us all unique. And that's why, none of us are the same. That's why siblings, even though they may look similar, they're not identical. So that's what you've got on that. Mitosis helps us grow. If your skin, it regenerates, you've got more cells that come out, it looks the same. Your stomach, your intestines, those kind of things. But meiosis, it totally is a unique type of thing. So any questions on that?
Um,
I
I
think
don't,
I'm good. I
yeah.
don't think I have any. You did a great job explaining that. Thank you.
So, same and different. That's really the way to look at it.
Awesome. How would you say that hormones like estrogen and progesterone impact the body?
Okay. Well, first of all, do y'all know that what I do, what type of nurse practitioner I am?
Yes, OB-GYN.
Yeah, so I'm a women's health nurse practitioner. So I deal and I see patients all day long in women's health, both gynecology and obstetrics. And so, progesterone, estrogen, those are a big thing in discussion, education. And as we teach in the process of, throughout the gamut of, patients from the age of 12 all the way to 75, 80 years old, hormones play a process. Estrogen and progesterone can be found in males too, but in this situation, we're really going to be talking about females more and how it
Mhm.
impacts the life and the body of the female, because these are the female sexual hormones. Estrogen, let's talk about estrogen first. Both of them, of course, produced in the ovaries. There's other forms that can be, but we're going to talk about those mainly, estradiol and progesterone. It's essential for female growth, for development, of course, the female organs, the breast, the uterus, the ovaries. It also helps maintain the menstrual cycle, facilitates preparation of the uterus for any type of pregnancy. So when we're looking at the muscle, we're looking at the lining of the uterus. That is a really, really important thing to think about whenever you think about estrogen. They actually it's a symbiotic relationship that estrogen and progesterone play in the female cycle. Some of the other things that you learn, and I know we're going to talk about some other stuff going down the road, but estrogen also helps with bone health when we talk about osteoporosis and what have you. Bone health, estrogen plays a huge role in that. Optimizing brain function, so that's very important, and regulation actually of depression and your mood. So as a woman cycles through, sometimes people can get PMS or irritability, mood swings, those type of things, and that can cause fluctuation as the estrogen fluctuates as well. And then if on the flip side, we can talk about progesterone in the reproductive system. So one of the main things that progesterone does, it actually is both a protection for the endometrial lining, but also helps promote an environment in the uterus. So if you think of the uterus, you've got the fallopian tubes, you've got the ovaries up here. So whenever I'm talking to them, does everybody know what an endometrial lining is? Or should I go into that a little bit more? No, I see a shake of a no down there. So let's talk about that. So we have, if you look at female anatomy, you've got the uterus. So these are the sex organs, uterus, fallopian tubes. You've got the ovaries up here, vaginal area, and the cervix is the bottom portion of the uterus. The cavity of the uterus is lined with a tissue called the endometrial lining. Okay. And so that endometrial lining, when a female has a period or their menstrual cycle and they have a bleed, that's actually what's sloughed off whenever you have your period. So these hormones play in that lining and how it fluctuates. So number one, progesterone protects that lining. Number one, if you're not pregnant, the progesterone helps keep the lining thin, because if we didn't have progesterone and we just had estrogen over here and it's giving all this estrogen to the endometrial lining, what can happen is hypertrophy or growth of hyperplasia of that lining. So it can get thicker and thicker and thicker, and actually can lead to endometrial cancer if gone untreated. The progesterone actually keeps that lining thin so that doesn't occur. So that's why I say it's kind of a symbiotic relationship. What else it does is actually, if you get pregnant, it provides an environment for the actual egg to implant into the lining. So it helps, it gives nourishment. It prepares that whole environment, for the implantation of that egg and sperm, fertilized egg and sperm. Some of the other things that progesterone does, it prepares the breast for breast milk production, helps with fat distribution in women, which sometimes we don't like. So after menopause, that's not such a good thing. Stimulates hair growth. Or weight gain and appetite. It helps with that. Behavior, your moods, actually with the central nervous system and the kidney functions. Bone health, it helps with that too. And it can actually help regulate the immune system, cardiovascular system, and respiratory system too. So it all plays a role in that. Any questions?
Awesome. I personally don't have any questions. Do y'all have any questions?
No.
All righty.
The next question is, how do birth control methods like hormonal contraceptives impact the body to prevent pregnancy?
Okay, so how does hormonal, so that's a key word that you just said there, hormonal, and I think there might be another question too coming up, but so, we're going to just talk overall, and then we'll talk more specifics in a little bit, but hormone contraception, so we're going to talk about the ones with hormones. So you've got contraception that is combination hormones, where you have both estrogen and progesterone. And then we also have hormone contraception that is just progesterone. So they work similar, but if you have a combination medication with both estrogen and progesterone, what this does, it releases the estrogen and progesterone into the entire body. And it does, the main way that this particular work, when there's combination, it almost puts the ovaries at a dormant state, and it actually causes you to stop ovulating. Some of the other things that it does is it actually thickens the cervical mucus. So it keeps the sperm actually from entering into the uterus to be able to meet up with the egg. And then it also can thin, like we talked about progesterone already, it can thin the endometrial lining to keep it really, really thin. That cavity with the lining inside that you slough off, it can keep that lining really, really thin. So it's not a conducive environment for the egg and the sperm, the fertilized egg, to actually implant. So those are some of the ways that it works. Now, if you're just doing a progesterone only, it doesn't always cause you not to ovulate. That's the difference. A combination, when you have both of them, it's kind of like you've put your ovaries to sleep. When you just have progesterone, a lot of times you're still going to ovulate, but it works with the mucus, and it works with the lining of the uterus. Next.
Okay, can you explain the differences between hormonal and non-hormonal birth control methods and how they work to prevent pregnancy?
Absolutely. So there's quite a few here. So are y'all taking notes, or I'll give you them because I do contraception discussions a lot in the office. That's a huge education that we do and I actually use a lot of devices. Like I show people, I like to teach and I like to show so you know what you're talking about, hands-on type of stuff. But once again, contraception, if we're talking about combined contraception, that's got estrogen and progesterone both. Now that can be delivered in a pill, that can be delivered in a patch that you can wear. It also can be delivered in a ring that you insert vaginally. So that's the main ways that a combination medication is given. Once again, those stop ovulation, prevents the ovulation, slows down the egg through the fallopian tubes. So it takes a little bit longer for it to come on down. It also changes the mucus and then also thickens that thins that endometrial lining because you've got both of the hormones there. Okay, so that's what you've got when you've got a combination medication. Then let's talk about progesterone only. So some of the progesterone only options that you have, number one, you have a progesterone only pill, and that's called the mini pill. That particular pill, as well as there's a Nexplanon that's a little capsule, a cannula that we can insert in the top portion of the patient's arm, and that's progesterone only as well. And then we have 4 IUDs that are intrauterine devices that are placed in the uterus that actually deliver progesterone. That does circulate in the body as well, but it's a smaller amount. There's also an injection called Depo-Provera that is a progesterone only injection as well. And all of those, once again, those particular devices thickens the mucus in the cervix, thins the endometrial lining, and partially, we'll call it that, suppresses ovulation. Okay, so those are hormonal. So if we're thinking, what am I, because I know probably your generation looks at TikTok quite a bit, and everybody's on TikTok and they say, oh my gosh, I want non-hormonal. We don't want to have hormones. Hormones can actually benefit women a lot, just more than just with contraception. With patients that have polycystic ovarian syndrome, their hormones are off, certain things, heavy bleeding, bad cramping, or we call it dysmenorrhea. These are actually medically necessary medications to use to help with that. So it's not just contraception that we use those things for. But if you think of other contraception that's non-hormonal, there's a couple of options. Of course, we've got condoms, abstinence, that's number one. Then, of course, we have condoms. Then there's a medication out right now, you may not know about it. It's called Phexxi, which is it's built up a couple of acids like lactic acid, citric acid, and it's almost like a spermicide, but it's not. You inject this gel into the vagina, and you use that within an hour. You can have intercourse within that hour. What happens with that gel? It's hard for the sperm actually to move through that gel, so it doesn't go through the cervix. The other option, non-hormonal, would be a Paragard, which is a copper IUD. Those are devices that are also inserted into the uterus that stay there for about 10 years. It's wrapped, it's a T shape like this, and it's wrapped with copper. And what happens is that actual copper on that IUD causes an inflammatory process that is actually toxic to the sperm and the egg. And it also keeps that lining really thin. So when you think of it, you've got hormonal contraception and then you've got non-hormonal contraception. And on all of it, when you look at reproduction, contraception is only as good as the user. So some of these are more effective than others because they're either devices that are, taken, or they're inside of you, if you want to call it, like an IUD or a Paragard or those kind of things. And there's some, so you just have to remember that. And that's how it works with reproduction.
We're going to go into some more personal questions.
Okay. Did y'all have any other professional questions that you needed from the list?
That should be it.
That
Yeah,
should be
that
it?
should be it.
Yeah.
Just for timely reason. Yes, ma'am.
Okay, perfect.
So, what does a OB/GYN nurse practitioner do?
Well, what I just told you all about. No. What do? I get up in the morning and go into my office. I work in a clinic here in Austin and Ascension Medical Group, and I see obstetric and gynecology patients through the lifespan. So if a patient is pregnant, they'll come in for their visits. I do ultrasounds on there. I confirm their pregnancies. I date their pregnancies, and I follow them through the pregnancy. I take care of any type of problems they're having, from high blood pressure to decreased fetal movement to hyperemesis to many other things. So I carry them through the entire pregnancy. The only thing a nurse practitioner doesn't do is I do not deliver babies. You can round in the hospital, and I've done that in previous jobs. Seeing them in the hospital, discharging patients from the hospital, taking care of them in the hospital. I just don't deliver. What the other option or other thing that I do is gynecology. And so gynecology is taking care of women's health throughout the lifespan. And that is from either annual exams, doing pap smears, breast exams, head to toe exams, birth control discussions, taking care of contraception. I take care of women in menopause and discuss hormone replacement therapy. Patients that come in with heavy menstrual bleeding or pelvic pain or what have you. We take care of it all. Breast problems. So I see patients, like I said, every day, about 20 to 22 a day, and try to facilitate a healthier lifestyle for the women in Austin.
Awesome. That's amazing. Um, so again, just for timely reasons, since we only have 2 more minutes, I think we can just ask you, like, what's some advice that you would give to anyone studying in biology and who wants to pursue a career in healthcare?
Just remember, like meiosis and mitosis, we remember what those are, but sometimes you're going to forget some of the stuff. But everything truly does build on each other. And just as you go through the process, some things may not seem relevant, but just know that, truly, even when you're thinking about these things, it will build on each other, and they are important. And it's something that you can go back and share with your patients. You can use in education, you can use in doing an interview like this, but it's definitely a fundamental building block to your education.
Awesome. Thank you so much for meeting with us, Miss Palmer. Okay.
Sorry,
Hey.
can I ask a question really quickly?
Oh,
Can I
sorry,
ask
go
a
on.
question?
Yeah.
Okay, so just really quickly, as someone who is also interested in nursing myself, I was just wondering what kind of inspired you to pursue this kind of like more advanced nursing degree as opposed to just being a registered nurse, or maybe something else like a PA or something like that?
Very good. Great question. I was a labor and delivery nurse at Seton Hospital, actually, when I got out of nursing school at UT. Just knew all along. I've done multiple things in my career, from owning in my own business, working for a software company, and being a medical advisor, nursing career. But I knew that I wanted to be able to have the autonomy to see my own patients, and flexibility in my lifestyle too. So that was really helpful. But I knew I had more to give and wanted, to advance my education and be able to do that. And the nice thing about a nurse practitioner is that I actually have my own patients. I have my own clientele. I've been in the business for 25 plus years now. And so, I've seen some of my patients I've had for years and years and years, and I get to go through their entire, through the process of having babies and taking care of them afterwards, and them having grandbabies down the road and all those kind of things. So it's just a really neat process, and you do have a little bit more autonomy and just get to experience some stuff that's a little bit more than just the nursing process.
Awesome. Thank you.
Yeah, absolutely. Anybody else?
I don't think I have any more questions. You've explained everything beautifully.
Well, thank you. I'm glad y'all got to do this. And thank y'all for inviting me to be your person today. And it was a joy. And if y'all ever need anything else, I'm here.
Awesome. Thank you so much,
You're
Ms.
awesome.
Palmer.
Y'all take care. Have a good evening.
Thank you.
Thank you so
Uh-huh.
much.